Hello, everyone. Welcome. It is Lisa Wessell from Encompass Women's Health and me, Diane, her trusty sidekick. Be sure to like and subscribe to our YouTube channel. And thank you for continuing to listen. We have a lot of fun making these. And Lisa is such a wealth of knowledge that I learned so much off of every episode. So thank you, Lisa. And today
Yeah.
we're going to start. We got a question from Lisa's Ask Me Anything, and it's about bleeding in menopause, specifically postmenopausal bleeding. And the question was, I didn't know it was a thing, but it seems that I can get it from viruses, anesthesia, and aspirin. When is the bleeding okay? When should I check in about it? And what are some other causes of postmenopausal bleeding?
All right.
Take it
That's a
away.
great question. Yeah, that is amazing. It's important too. The definition of postmenopausal bleeding, it coincides with the definition of what is menopause. 12 consecutive months of no period. After that, it would be considered postmenopausal bleeding. It is kind of just a line in the sand that we have to decide when is this normal and when is this not normal. So women who are going through perimenopause or transitioning where they have not gone 12 consecutive months, it helps us to differentiate, like, is this normal? Like, do we expect this? Yeah. For example, myself, I haven't had a period. No, that's not true. My last real period was in December. We're in June. I had like a little bit of spotting in April, a little bit in May. Like, do those count? Yes, they do. So like my reset now is not from December, it's from May. Even though it was 2 days super light, that's still, so like I'm in this transition phase for myself. Now, if I go from May to May and it's now like 2027 of August, that would be considered postmenopausal bleeding. So that would be something of, is it a concern? What do I need? What do we need to do? And this is what's so hard. And I hate saying this because as women, we are catastrophic thinkers. So we go from 0 to 90 and like worst case scenario. It's just what we do. And we could go into the whole reason why we do that. But the reason why we evaluate postmenopausal bleeding is we want to make sure it's not cancer. And that can happen whether you're on hormone therapy or not, but it's not normal. Now, if you've gone 12 consecutive months without a period, and let's say you are 2 years into menopause and now we started hormones, and within 6 months to a year of starting hormones, we have postmenopausal bleeding. Is that normal? It's not surprising. So when we introduce hormones back into the system, our body kind of like gobbles that up and it's like, oh my God, where have you been? This is what I'm supposed to do. And so like people can have a period. It's not really a period though. So it can be normal, but I usually tell people at the end of the day, always let your provider know. If you have gone a year without, let them know. Now, there's some caveats here. I have some women that are 58 years old and have never gone a full year without a period. You do start to like around that time frame, like, hey, this should be ending soon. What's going on?
Right.
So what do we do? Like, I guess the thing is what would be normal? So yeah, number one, the first question that's always going to be asked is, and this would be if you have a uterus as well, too, like, because if you didn't, you wouldn't be bleeding from somewhere else. Have you missed a progesterone dose? Because progesterone in the progesterone hormone replacement therapy, progesterone helps to keep that endometrial lining from growing and keeps it thin. 9.9 times out of 10, it's a disbalance between your estrogen and progesterone production. You have a little too much estrogen in comparison to progesterone. You have too much progesterone in comparison to the estrogen. Both can cause postmenopausal bleeding. But usually some spotting, again, have you missed a progesterone dose? Has something happened? Like, have you travel? Have you been sick? Those sorts of things can cause a weird response. If it's some spotting goes away, for me personally, I usually am like, okay, one time, let's just keep an eye on it. If it happened again, let me know.
Mm-hmm.
The most conservative thing to do is let's do a pelvic ultrasound. Let's look inside. Is there any pathology going on? How thick is that endometrial lining, which is what you're sloughing off? The line in the sand is anything greater than 4 millimeters. If you're postmenopausal, anything greater than 4 millimeters should be evaluated, meaning it's a biopsy where you go in and you go in doing a procedure. It's called an endometrial biopsy. You go in, you take a little sample, send it off, make sure there's no abnormal cells there. Again, 9.9 times out of 10, it is nothing. And we are just trying to balance out this estrogen and progesterone. And so a lot of times you're going up on the progesterone, stabilizing the uterine lining, stopping the bleeding, and then going from there. It's a lot. And some people, it depends on the, person too, like what's going on. How are you emotionally? Is this going to freak you out if we don't do an evaluation? If it's just some spotting for myself, I'm usually like, let's keep an eye on it. But if you're like, oh, I'm bleeding, like
Right.
we need to look into it, like what is going on. Women also, like the causes are postmenopausal bleeding, or that disruption between your estrogen and progesterone. Is there anything anatomically going on within the uterus? Are there polyps that are developed or that are already there and now we stimulated them with hormones? Polyps will only grow in the endometrial lining and they can cause the area to be bigger and it just kind of builds up. And really you need to, a lot of times it's like, hey, we need to go in there and remove them, which would be a procedure where you go in and remove and you go from there, making sure that's not anything.
Can stress impact postmenopausal bleeding?
Yeah. Stress can impact everything. Yeah, I think that's the thing. We don't give the power of stress in our body.
Right.
We don't give enough attention to. So like if you wanted to the research, like stress and your endothelial lining gets irritated. So stress, like if we're talking, if you just kind of go with the type A personality, stressed out, can that cause hypertension? Yes. You know what I mean? So yeah, so it can affect it.
Well, and I assume also it's inflammation. Inflammation doesn't just pick certain spots, it's universal,
Yeah.
correct?
Yeah, absolutely.
What about viruses?
Yes. Like, yes. Yeah.
And we've talked about the importance of getting tested for STIs, even in a committed relationship, making that part of your wellness, well woman check is to get
Mhm.
tested just to make sure that that's not a culprit.
Yeah, I would say not typically, but like when you can't find a pathology as to why, like it's something to like rule things out.
Yeah.
What else could be going on here is, like you can dive really deep into things too. You can start
Right.
looking at autoimmune and things like that. So like any inflammation in the body, but typically it's due to hormones, the imbalance.
Does the color of the blood or the discharge matter?
I would say, like when we're talking postmenopausal, it's going to usually be old brown blood, like something that's like, but like not enough. You know what I mean? Like, so old brown blood, what does that mean? It means it's been sitting there. And it's kind of sloughing off. Like it's not fresh. It's not new. Does it make a difference? I would say, yeah, kind of. And the fact that if you told me like it's old brown blood, it was for a day and went away, I'm not really concerned. If you're like, it's bright red bleeding and I am having a full blown, like, super tampon moment, then I would say, yeah, let's get an ultrasound.
Okay.
Let's see what's going on there. So I would say there is a difference. Like this is fresh new blood. There's something going on here
Right.
that we need to like not ignore.
What about clots?
Same.
Okay.
You know what I mean? Like I would say same because that's enough blood buildup, that's been sitting there and now decided to work its way out. The reality is that when we use hormone therapy, like it can basically like things that they're usually that pathology is already there. Usually most of us, when was the last time you had a pelvic ultrasound? Like most of us don't have, that's not a routine thing that happens or people do yearly. So usually there's a pathology of some kind that was maybe already present, going on. And then we gave them estrogen and we gave them progesterone. And it kind of was like, oh, cool, my hormones are back. So it causes something to maybe grow a little more or be a little more present. And then we start to see a problem.
Okay.
And problem would be a strong word. Like,
Right. Abnormality.
we have an abnormality. We have a side effect now that we have to look into.
Okay. When I started using estrogen and progesterone, it felt like I was going to get a period and I haven't, but my body was like, "Oh, hey, these are long lost."
Yeah. Yeah.
Welcome back. So good to know that that's normal.
Yeah.
And
I was gonna say it's kind of like when women start hormone therapy, like the breast tenderness. You know what I mean? Like, and so like it doesn't stay that way. Sometimes it's like, oh, that's a sign that might be a little too much, or it dissipates out. It's kind of like, oh, okay, but it doesn't always stay.
Right.
So it's just like it's something new in the system that your body, well, number one, it wants, it likes, it feels better with, but it has to kind of adjust because like, oh, I haven't had this in a while.
Right. I keep thinking of like the sponge. This is a bad metaphor potentially, but like, you're this dried, shriveled up sponge, and now you're introducing hormones back, and it's like, ooh, so the sponge is filling up, and sometimes it leaks because it gets so full.
Yeah, absolutely. Absolutely. So at the end of the day, I would say like The reality is this: any postmenopausal bleeding should be evaluated, which means anytime you've gone a full year with no period and then you start having bleeding, it should be evaluated.
Mm-hmm.
Now, that evaluation can just be like, I contacted my provider and we had a discussion about it. And this is what was recommended. And it gets kind of tricky. Again, like I have some people that are 58, have never gone a full year. You start to like, well, let's look at that. And it's a hard sell sometimes. Like I had an ultrasound last year, Lisa. I had to pay out of pocket for it. Like, I don't know that I want to do one again. It's like, well, that's the only way we know.
Right.
If there's anything going on, I think that's the thing, is sometimes it's just annoying. But
Do polyps just go away on their own, or once they're there, are they just their permanent residents?
they don't go away on their own and they can grow back. So some people are just prone to them. Polyps like remind me, they're like, so if you I had a patient who was like, don't ruin avocados for me, Lisa. But if you take an avocado and you cut it in half and pretend this is your uterus, the green part of the avocado is the muscle of your uterus. The seed is your endometrium. That's what we slough off every month when we have a period. Polyps will only grow in the seed. And so what ends up happening is kind of like you get all of these little grapey, clustery things, and it's making that seed now bigger. And fibroids will only grow in the muscle of the uterus in different spots. So I usually take an M&M and push it into that avocado, like that's a fibroid. And you can put it on the top of the fibroid. You can put anywhere. But fibroids typically don't cause uterine bleeding. The only time they do is if they're pushing into that endometrium. Polyps tend to cause like heavy periods, heavy bleeding. Polyps are estrogen. They're both estrogen driven. So a lot of us have fibroids. You just don't know it because you've never had an ultrasound. But most of us is just from our own estrogen that's been there our entire lives. And some people just are prone to polyps. And so typically polyps are something that you have to have removed.
Okay.
Or at least you're aware of it, and eventually, like some people will continue to have problems with them. But then then you go through menopause, you don't have the estrogen, and then we give you estrogen, and you'll have bleeding.
Okay. Thank you for covering the postmenopausal bleeding. If you ever have a question for Lisa, you can always go through on the bottom of every email. You can click on the Ask Lisa Anything link
Yeah.
and you can fill out the form. And if you haven't signed up for her email yet, you can also click on the show notes and sign up for her email.
Please do.
All right. Thank y'all.
Bye.